Your uterus plays an important role in your overall health and well being, especially for women of reproductive age. However, sometimes our bodies give us a warning signs that something is not quite right. In today's video, we will be discussing the top warning signs of uterine problem that you should never ignore. Early detection can make a significant difference in treatment and recovery. So stay tuned to find out what these key symptoms are. Number 1, abnormal uterine bleeding. Number 1 on our list is abnormal uterine bleeding. This includes heavy periods, spotting between cycles, or irregular periods that seems to come and go unpredictably. While some variation in your menstrual cycle are normal, persistent heavy bleeding can signal conditions like fibroids, hormonal imbalance, or even more serious issues like uterine cancer. If you are bleeding heavily, more than soaking through a pad or tampon every hour for several hours in a row, or experiences irregular spotting between periods, it's important to consult your doctor. Don't brush it off as just as a bad period, as ignoring these symptoms can delay necessary treatment. Number 2, pelvic pain or pressure. Next up, we have a pelvic pain or pressure. Persistent discomfort in the lower abdomen or pelvis, as well as pain during intercourse, can be a red flag. Common causes include uterine fibroids, endometriosis, or infections. In some cases, even a retroverted uterus where the uterus tilts backward can cause discomfort. Many women experience mild pelvic pain during menstruations, but if the pain is constant, severe, or linked to sexual activity, it's important to have it checked out. Conditions like endometriosis, where tissue similar to uterine lining grows outside the uterus, can be managed with medical help but only if caught early. Number 3, unexplained fatigue or weakness. Unexplained fatigue or weakness is another warning sign. While tiredness can be linked to anything, chronic fatigue that does not seem to improve with rest could indicate a deeper issue. For instance, conditions like fibroids can cause excessive blood loss during period, leading to anemia and fatigue. If you are feeling constantly drained even when you had enough sleep, and especially if it's paired with heavy menstrual bleeding, a blood test may be needed to check for anemia or other underlying issues related to uterine health. Number 4, frequent urination or difficulty urinating. Another symptoms that might surprise you is frequent urination or difficulty urinating. If you are constantly needing to go to the bathroom or you feel like you are unable to empty your bladder completely, this could be due to pressure from an enlarged uterus. Conditions like uterine fibroids or a retroverted uterus can press against the bladder, causing these issues. If you notice these symptoms becoming a regular issue, it's worth discussing with your healthcare provider. They can help identify if your uterus is the cause of the bladder problems and recommended the appropriate treatment. Number 5, unusual vaginal discharge. Unusual vaginal discharge is another sign that could never be ignored. While it's normal for vaginal discharge to vary throughout your cycle, any discharge that is thick, foul smelling, or discolored like yellow or green could indicate an infection. More seriously, infections such as pelvic inflammatory diseases or even cervical and uterine problems may be culprit. If you notice any significant changes in your discharge, especially if it's accompanied by a bad smell or discomfort, schedule an appointment with your doctor immediately. Number 6, pain during intercourse. Pain during intercourse, known as dyspareunia, can be more than just as inconvenience. It could be a sign of underlying uterine issues like endometriosis or uterine fibroids. These conditions can cause the uterus to become tender or distorted, leading to discomfort during sexual activity. While it may feel uncomfortable to bring up, it's important to talk to your healthcare provider if intercourse is consistently painful. The earlier uterine conditions are diagnosed, the more options you will have for treatment. Number 7. Lower back pain. Lastly, persistent lower back pain can be another sign of uterine problems. This is especially true if the pain is localized and does not seem to be related to muscle strain. Conditions like a retroverted uterus, fibroids, or even infection can cause this type of discomfort. Don't assume that back pain is always muscular. If it's coincides with other symptoms we have discussed like abnormal bleeding or pelvic pain, it could be worth looking into. It's important to listen to your body. These symptoms might seem mild or unrelated, but they can be early warning signs of more serious uterine issues. Don't hesitate to contact your doctor if you are experiencing any of these symptoms. Thank you for watching. Remember, taking care of your reproductive health is crucial for your overall well-being. If you found this video helpful, please like, share, and subscribe for more health tips. Stay informed and stay healthy.